Well, the rest of the team will be back in a little bit. I just passed them coming back, so we'll have the whole complement pretty soon. Mr. Warren, did I understand it correctly that you're the information technology person?
Yes, sir, I have that role.
Well, I'm about to demonstrate that I'm not, but I have a question about that I'd like to get an answer to. I've been reading about the VBMS, the Veterans Benefit Management System. I understand it's fully deployed now from a standpoint of being installed, but it's not operational. Is that right?
Senator, it's fully deployed, fielded. It was completed last June, 6 months ahead of schedule. It is being used, but it is not the only means of processing a claim today. This is probably the big crossover year for us. We still have claims in paper, and so the great workforce that we have is dribbling 2 basketballs at the same time. They have to be able to do paper today because that's the legacy system. But every day, less paper, and sometime later this year will be only digits. And they have to do digits at the same time today. So it is functional, but we're not totally reliant on just VBMS today.
What I read, I think there's about a $44.5 million in the budget for the continued installation of that. Is that correct?
Let me turn to Mr. Warren on that.
The number is actually $137 million is being requested in the 15 requests, and would appreciate your support for that, sir.
And here comes my question that's going to illustrate my ignorance, probably. It's said in here that you're using an agile approach in terms of the installation, and that you are deploying different patches, and that this will take some time to complete. Would you tell me what kind of patches you're talking about, or that they're referring to?
Thank you for that question, sir. Agile is an approach where instead of putting all your requirements together and then many years down the road you bring capability online. As the Secretary mentioned, systems have been brought online, and every 90 days we put more capability, more function in the hands of the employees in VBA so they can keep processing more. So it is an iterative process. Every 90 days major functionality gets deployed, and in between the 90 days, if there are things we need to adjust or tweak, we add that capability in as well. So high frequency, high cycle rate, making sure we're putting capability on the ground so that the folks in VBA can drive ourselves to that outcome.
Senator, if I could try to, he's a techie person, I'm not either, so let me try to put it in our terms. 2 ways to approach a large IT project, and it doesn't apply to the smaller IT projects, they're a little more manageable, but a large IT project, you can wait to design the entire elephant and then try to field that whole thing at once. And what sometimes happens is you'll find something doesn't work in this large project, and then it's difficult to find it because everything's out there. The agile approach that Steph Warren is describing is we have an idea where we want to go, but we know where we want to start, and we start modestly. We put a segment in. We let it run for 90 days, and we see what hiccups and burps, and then we fix that because we can find it in that narrow slice. And then we realize we need to add some more capability, and we do that. Over time, it sounds like these incremental approaches would take longer, but they're actually faster, and that's been our experience.
The thing I want to be sure of, and in leading up to what I'm about to ask you, I've had one experience with a statewide installation of a computer system into 179 school systems that I had to fix a bad problem that was related to patches, where they had tried to custom make the software to be site-specific rather than system-specific, and the patches were used to correct that. I'm taking it from what Mr. Warren has said that you are phasing in the installation of the software, but that it is universal. You're not patching at each site, you're patching it for the universal system. Is that right?
Yes, sir, that is the case. It's a national deployment, so when we roll out capability, every regional office gets that capability, and they're able to use it the next day once it comes on.
And you're not correcting a problem. What you're doing is phasing in a activity. Is that right?
So we're adding more capability every time we bring new functions online for the benefits folks.
Well, you're doing it the right way, because I did it the wrong way in the state of Georgia, and I paid a terrible price for it. So that's why I asked that question, because you can't do that site-specific stuff. You've got to do it universal in the system.
Yes, sir.
Dr. Petzl, I want to correct something that was in the record, and it was reported that you inferred that I don't think you probably did infer, because I've talked to you about this before and you testified in my hearing. But you had a hearing in February with the House Veterans Affairs Committee, and you stated, it says, and I'm quoting here, it says you stated the IG report related to mismanagement of the Atlanta VMAC did not connect deaths to mismanagement, but I believe you have stated before my hearing in Atlanta, as well as personally to me on a number of cases, that there was mismanagement issues that contributed to the suicides in Atlanta. Is that correct?
You're absolutely right. I had misspoken in the... You're absolutely right, Senator Isakson. I had misspoken in that I was referring to the review of the contract, not the review of the care on the facility. The contract review by the IG, they didn't directly connect it, but they did very definitely connect this. Activities on that ward with a suicide death. Absolutely right.
Well, because of what you've done on this, I wanted the record to reflect accurately what you said in both cases. And I want to publicly acknowledge the fact that you've come to Atlanta and met personally with survivors of some of the victims of the suicides in Atlanta, and it's provided a great service and a great sacrifice on your part to do so, and it's very much appreciated. Secretary Shinseki, on this issue of suicides, one of the big questions that's being asked, and there's a lot of press looking into this in Atlanta, and I'm sure there's going to be something hit one of these days, so I want to be prepared to answer this question. What are there contractual limits or union limits, or what kind of limits do you have to reprimand or correct or otherwise dismiss an employee for inappropriate activity, mismanagement, or contributing to the failure of the system to deliver what it's supposed to deliver? Explain to me what you have to do to discipline or reprimand or move or fire an employee.
Senator, I would say that I believe we have the tools that we need. First of all, VA employees, by and large, 30% of us are veterans ourselves, so we have familiarity with the issues our veterans face, and there is a tie to them. And we are deeply committed to our mission. And in these discussions, transparency and accountability count when we're trying to establish and maintain trust. I would say that in 2012, we dismissed, involuntarily removed, over 3,000 employees. In 2013, we did the same thing.
Is that in the total VA or just the medical services?
This is all of VA, but a large part of us is the Veterans Health Administration. They account for 70 or 80% of our workforce. And at 3,000, we're talking about a percent of our workforce. 6 senior executives were also dismissed over the past 2 years. I think what I would also like to add here is that many of these incidents were discovered by VA employees, raised by them for our attention. We then, as transparently as we could, did our investigation, shared the information so others could learn from it, and then set about correcting and then preventing future occurrences. An important part of this is the courage and willingness of VA employees to stand up and report, in some cases on themselves, that they made a mistake. And that allows us to take the corrective actions we have been able to do. And I, for one, value that. I never want us to see us lose that. And so this is part of this environment of trust that we're trying to retain. It's unfortunate any time a suicide happens. It's a terrible tragedy, or any time we lose a patient under our care. And the important thing is to never let it happen again, or at least commit to never letting it happen again. To do that, we have to find out what happened and get about correcting action, and then holding people responsible where their performance did meet our standard. And as I say, I think we've done that here the past 2 years.
I appreciate that answer, and I've run over on my time. I want to go to Senator Murray, but before I do, very briefly, 3,000 per year the last 2 years have been dismissed in terms of VA employment for various different failures to perform services. How long does it take from the time you initiate an action to dismiss an employee for cause? Can you actually dismiss them? How long does it take you to go through that process? A
good question. I probably ought to just go ahead and do a little research and
send me a
provide it to
memo
you for the record.
It's coming to you from a reporter out of Atlanta, so I'm trying to give you a heads up, and I want to be able to have the right answer when they call me, too.
Okay, well, let me provide you a good answer.
Question, if I can ask it while we're still going, and we apologize for the gymnastics with the vote. Mr. Secretary, your implementation of several initiatives regarding the transformation process at VA, you've instituted mandatory overtime, segmented lanes, Veterans Benefit Management System, fully developed claims, e-benefits, et cetera. Can you tell us which of those initiatives have proved successful and beneficial to you?
Certainly. I think I would just cap it all and say all of those have been successful, some more so than others, but in some cases their delivery came at an earlier point, and we've had more time to assess them. Let me turn to Secretary Hickey for some details here.
So, Senator Isakson, I would couch it by saying the following. We've implemented them, as the Secretary has said, on a sort of a staggered approach. And I can tell you that many of them contributed to our record-breaking 1.17 million claims production at a high quality and accuracy level last year alone. And I will tell you we're 26% ahead of where we were even last year at our record-breaking levels of production. In fact, by example, our hardworking VBA employees, who are 52% veterans themselves, are, as you said, working overtime 20 hours a month to produce, in the month of February alone, double the production than we have put in a month of February before. So we are seeing all of these different efforts producing good value for our veterans in terms of timeliness and accuracy. I would call out one in particular from our veteran service organizations, and that's our fully developed claim process, where since February of last year, we've gone from 3% of our claims being fully developed to over 28% of our claims being fully developed, and that will do nothing but add to the benefit to a veteran as we move forward.
Thank you for your answer, and I'll turn it back over to Chairman Sanders.